Well, Arne, I think it's common knowledge that we have a shortage of veterinarians in the United States.
Absolutely.
And maybe it's even more critical that we strive to have these relationships between producers and veterinarians that are effective for both parties.
Well, Glenn, we're going to start what we've already mentioned before, and that's establishing a relationship with your veterinarian. Meet him before you have a problem. This allows the veterinarian to understand your operation, understand your goals, understand your needs as a ranch, what you're trying to achieve, and this makes our service to you all that more efficient and all that more effective.
What are some specific recommendations that you would make to a producer in terms of when they need to call you?
What we like to do when we go out to a ranch is to literally establish a list of benchmarks, a protocol, if you want to call it that, of when to call your veterinarian. And it may be something as simple as when the temperature crosses 103. If you have multiple systems involved and multiple clinical signs like a lameness or a respiratory problem combined, then it's time to call your veterinarian. And obviously, if you've had a sudden death incident or multiple deaths, it's a time to bring your veterinarian onto your ranch to try to determine what's going on. So yeah, those are some specific areas.
What about specific rules of engagement?
What we try to train our ranchers to do, or try to indicate that we would like done, is one, have the animal identified. That sounds silly, but often when you're dealing with large herds, this can become a problem. We want to know which animal we're supposed to treat. We like those animals to be caught up in a pen when we get there. When they see these green coveralls, they run for the back 40 every time. So it's important to have them caught, and then it's also important with sick animals or with any animal to treat them humanely. Let's not get them excited before we even get there. The less stress, the healthier the animal. We need to talk a little bit about the importance of establishing a herd health calendar.
Well, the herd health calendar, of course, builds around the breeding and calving season. And many
just what we're seeing now.
Absolutely, and many times the calving season on an operation is etched in stone. Many times that's tradition, or it may have been carefully thought out, and that is the best time to calve. But I think at least that question needs to be broached before you go any further in developing a health program. Are we calving at the right time? Is the length of our calving season optimal for our management and forage resources that we have? When we have a controlled breeding season, we can place our animal health inputs into the time period where they'll basically accomplish the most for the dollar that's expended.
It seems like an overwhelming task.
Well, it's really very simple. First of all, we don't want the protocol or the calendar to be standardized. We want the questions that are asked to be standardized, so that we can create a unique health management program and protocol for a particular operation. Only you as a veterinarian in that particular area truly know what is important in that geographic area, and so it's important to sit down and wade through all the fluff and all the products that are out there and just hone in on what is most important for that operation.
Any other steps that we can begin to continue this herd health plan? We've established a calving time, a calving period. What's next?
One of the things that we can do with a herd health program is establish the total number of products needed for the year. In many cases, that may result in a cost savings for our clients.
They'll be more efficient.
They're more efficient in their purchases, and they have a tangible document that accentuates what you told them verbally. Many times we give advice as veterinarians on the fly. Maybe while you're preg testing cows, you give advice on animal health information, and it may or may not be remembered. If we want specific products given, it needs to be in a tangible document where they can follow that. Something you can hold in your hand and use that as your blueprint for your health program.
It gives us maybe not a detailed plan, but an outline to follow. Again, we go back to that protocol that we were talking about. What do? It still leaves the rancher lots of freedom and areas to move within, but gives us a framework on which to build.
Sure, and with individual clients, I'm sure you've heard many come in and say, what do I need to vaccinate for this year? And you scratch your head and try to remember what we did last year. And this gives you an opportunity to have these individual health plans for each individual client available, and you can readily recall what was given.
That makes really good common sense.